Welcome to a virtual Commonwealth Club program. I'm Celia Menschel, chair of the club's member-led Middle East Forum. I'd like to wish everyone a happy, peaceful, safe, and healthy holiday season and New Year. The next Middle East Forum event is on January 27th. It's called the War of Shadows. If you'd like to know more about the War of Shadows and other intriguing programs, please go online at commonwealthclub.org. Now I'd like to introduce our distinguished moderator for today, Dr. Maher Kalaji, who earned his PhD in chemistry and was educated in Jordan and England. He spent most of his academic life in England and Wales. Dr. Kalaji has traveled widely in the Middle East and interacted with academics and students at universities throughout the region. After moving to San Francisco, he became a frequent contributor to the Middle East Forum, for which I'm forever grateful. He now lives in the Grand Duchy of Luxembourg, from where he is joining us today. Before I turn the program over to Dr. Kalaji, here is a 2-minute video on the occasion of World Refugee Day 2020. The speaker is His Excellency Tijani Mohammed Bande, President of the 74th session of the UN General Assembly.
On World Refugee Day, we hold the 25.9 million refugees of the world in our thoughts. Refugees around the world have made treacherous journeys in pursuit of peace, prosperity, and the full enjoyment of basic human rights. Life has become even more difficult for refugees as the world contends with the Covid-19 virus. Travel restrictions have prevented refugees from moving through transit countries. In camp communities, transition prevention measures are difficult to implement. Space is often at a premium, making physical social distancing impossible. Moreover, access to hand-washing facilities and health services may be limited, and personal protective equipment, if available, may be in short supply. I commend host countries for upholding the values of the Charter of the United Nations in providing for the people we serve in the context of an unprecedented global challenge. More than 134 host countries are reporting local transmission of COVID-19 and are working hard to mitigate the effects of a global health pandemic on the vulnerable group they host. Indeed, more than 80% of the world's refugees are hosted in low and middle-income countries where tenuous health systems are already under strain. I urge all member states to listen to and heed the voices of refugees and displaced persons as they respond to the COVID-19 pandemic. The health of every person is tied to the health of those farthest behind. On World Refugee Day, I thank UNHCR, IOM, and all humanitarian workers who have dedicated their lives' work to creating a better world for all. I commend the World Health Organization for its continued leadership throughout the COVID-19 pandemic. Today, I pay tribute to the courage and resilience of refugees everywhere. Your journey has not been easy. You have experienced hardship and encountered difficulties, yet you have persisted in pursuit of a future which is free from fear and full of possibility. We share your dreams of a better world for your children. Do not lose hope. We'll leave no one behind. Together, we'll build back better for a brighter future.
Hello and welcome to today's virtual meeting of the Commonwealth Club of California. I'm Maher Kalaji and I'm joining you today for this program from Luxembourg. I'll be your moderator for today's program, The Impact of COVID-19 on Refugees. Tonight's program and the club's new virtual efforts are generously supported by the Chan Zuckerberg Initiative in collaboration with local funders and donors. We're grateful for their support and hope others will follow their example to support the club during these uncertain times. We invite everyone to visit us online at www.commonwealthclub.org, and this program will be available soon on YouTube. A reminder to please send your questions for the question and answer period to chat. Our panelists today are Dr. Niveen Riskalla, Research Associate at the Center for Middle East Studies at UC Berkeley, and Amanda Lane, the Executive Director of the Collateral Repair Project, which is based in Jordan. We'll begin with Amanda Lane. Amanda is a seasoned international development professional with extensive experience in international community development, refugee relief, and community for the nonprofit sector in the Middle East, the US, and Africa. Thanks to her expertise in international development program evaluation and design, she is called upon by governmental and non-governmental organizations to evaluate their ongoing programs. She headed the British Council Jordan's governance and youth programs, designing and managing projects around the country that emphasized community engagement, human rights, and sustainability. Before coming to Jordan, Amanda consulted for nonprofit boards of directors in Seattle, made a number of short documentaries and promotional films for nonprofits, and served on the board of directors of the Arab Center of Washington. She also served in the Peace Corps in the Cameroon between 1993 and 1995. At Collateral Repair Project, Amanda oversees an operation that provides emergency assistance and community building services for urban refugees. She heads the organization's fundraising efforts and is responsible for program planning, partner relations, and communications. The organization caters for Syrian, Iraqi, Kurdish, and other refugees and victims of war and conflict. Amanda also featured in Unum, which is a magazine that highlights and showcases the stories of diverse women across the globe to elevate and inspire others. So without any further ado, I'd like you to welcome Amanda Lane, who is joining us from Amman, Jordan. Good evening, Amanda. The platform is yours.
Thank you, Maher. It's a real pleasure to be here. Really happy to be speaking to everyone today. I'm going to share my screen. All right. So I'm going to talk about refugees in Jordan and how COVID-19 has impacted refugees in Jordan. I want to start by giving an overview about what the situation is for refugees in Jordan in general, the numbers, just to give you kind of an overview. In Jordan, 1 in every 10 people is a refugee. And as you'll see, we have over 750,000 people who are refugees currently living in Jordan. Among them, the largest number by far are Syrians. And then we have a very sizable population of Iraqis, as well as a number of what we call minority refugees. And among those refugees, Yemenis for the past few years have been the fastest growing refugee population in Jordan. The majority of refugees living in Jordan are living in urban areas. And here where I work with the Collateral Repair Project, over 30% of Syrian refugees are here in Amman, but the vast majority of other refugee nationalities are here in the city as well. And refugees in general have severe obstacles in receiving any type of humanitarian aid. And in large part, this is due to the fact that the Syrian refugee crisis is now entering its 10th year. So a lot of funding came in the first years of the Syrian refugee crisis, but as you know, Syrian refugee stories are not nearly as much in the news as they used to be. Similar for funding and donors, a lot less funding, yet the struggles and the difficulties that refugees have still remains. So little bit of information about the struggles that refugees have had even prior to COVID arriving here in Jordan. A lot of their basic needs struggles and the ability to take care of their basic needs really relies on the ability or their inability to work legally. Legal work is only partially available to Syrian refugees and completely unavailable for other refugee groups. So it's very difficult for people to bring in the kinds of income that they need to bring in to make ends meet. Even if they are able to work, it's illegal and exploitation is quite common. Prior to COVID, 70 to over 80% of refugees in Jordan were classified as either food insecure or vulnerable to food insecurity. So already those struggles were quite great, and the difficulty of people to put food on their tables was very real. Added to that, a number of, or many families, refugee families, have members who have chronic illnesses or even serious health issues. So, things like diabetes, high blood pressure, depression, those are issues that are rampant in the community. And even for conditions like those, as well as even more serious conditions, it's very difficult for people to be able to afford the medications they need, or sometimes even surgeries or more involved health treatment. Another issue that is a huge stressor for families is the fact that many of them have crippling debt. Most families in our community are way behind in paying rent. They have borrowed and they have debt to the extent that, it's just a major stressor for them. To the extent that it's more than or equal to how much they might be able to bring in annually. As I mentioned, refugees in Jordan largely are living in urban areas. They're living in apartments. And as we're now entering the cold and wet winter season, this is the time of year when we have a lot of illness because the buildings are not heated. It's very difficult for people to keep warm. There's a lot of mold. It's not uncommon to walk into a family's kitchen and their rooftop is corrugated metal, for example. So really, really dilapidated living conditions that also really affect health as well. Public education, while it's accessible, there are a number of issues with public education, and this is speaking even pre-COVID. Pre-COVID, it's not uncommon for refugee families to have more than one or two kids, and the fact that they needed to purchase uniforms or books for their children is often a deterrent, and families cannot afford to do that when they have to prioritize their food or rent. So many daily stressors, so many issues that are just part of a daily stressful life for refugees, along with the fact that so many refugees have come fleeing trauma. So PTSD is very, very common. And those two things added together make it very difficult for people to be able to make sometimes safe decisions. Looking at issues that are not uncommon in the community, things like family violence, which we know worldwide has had an uptick with lockdowns. Family violence, sending a child maybe to beg on the street, or maybe even sending a daughter off for early marriage just because of the inability for people to take care of their families. I would be remiss if I didn't mention at least one of the many, many hundreds of families that we encounter who are just struggling and have been struggling prior to COVID, and really their issues have been exacerbated now that COVID has hit. This is a family from Iraq, and the man on the right who's holding up the medicine box, his name is Kamal. They're a family from Iraq who arrived in Jordan 3 years ago. And as you'll see, their living conditions are pretty basic. Their apartment's a little bit better than most, but they really don't have much furniture at all. 2 of their children have really debilitating epilepsy, and the medication that they need for their children is just completely out of reach in terms of what they're able to afford. Luckily, we're able to help and get the medication donated and taken care of for them. We also help them with rent. But Kamal talks about his inability to find work, that his time is spent, taking care of his kids, and really, really worrying because of their lack of income. And this is very, very common, that people just really have no idea how they're going to put food on their tables. We are also, as an organization, and it's very common here in Jordan, that because funding has been going away, families like Kamal's are in danger of losing their monthly support from us. So that's just one of many, many families who are in situations relatively similar. So ever since COVID hit, we have been reaching out to our community to see what their biggest current worries are. And the top two since April have been rent and food. Early on in April and May, food was the top worry that families were having. But since then, most families have really fallen behind in paying rent. And so that really, makes a lot of stress for families. I mean, it's at the top of their minds. We've heard many families telling us that their landlord comes and knocks on their door every day, and the kind of stress that brings. We can only imagine. Contracting COVID pops in at number 3, which probably is not a surprise to any of us. And then things like securing medication, milk, and formula for their babies and kids, which is quite expensive, as well as paying for their cell phones and internet connectivity. And I think I mentioned that schools have moved online in the past, I think for maybe, since kind of the end of the last school year and early on in this school year, things have moved online. And this has become a real issue because families don't have laptops at home. They don't have computers at home. They may have one cell phone that they're using and multiple kids and not be able to afford internet, because they have to focus on dealing with food or medication. So that has become a real issue as a result of COVID. This is just an array of issues that have really been exacerbated because of COVID. Food security, food insecurity has really increased because folks who, were working as day laborers or having sporadic work no longer have that work. So food insecurity has definitely raised. Healthcare continues to be an issue, and in one of our recent outreach assessments, we have been very concerned in hearing from 45% of non-Syrian refugee families in our community who have chronic health conditions and are unable to pay for the medication that they need. Education there on the bottom left, you'll see, I've mentioned it's moved online. Like everywhere, it's a huge challenge with a bunch of kids at home, but also that kids can't access education because they don't have internet. Cash assistance has continued to be on the wane due to donors kind of moving away from assisting refugees in the Middle East. And this is particularly difficult because of, the increased difficulty for people to bring in income. So only 2%, for example, of non-Syrian households here in Jordan are receiving cash assistance. Cash assistance for years is a way that people could stave off, falling behind on their rent. And that is no longer really accessible for most people. I will mention, in speaking of livelihoods and the ability to bring in income, aside from lockdowns making it difficult for people to access work, if they even have it, work disappearing, many families, and particularly Iraqi families in our community, rely on regular wires of money from family members abroad. And as we know, COVID has affected everyone around the world. And so a lot of those remittances or cash, income from family members outside are no longer accessible to people. So that also really strains them. So what we've been doing is Collateral Repair Project. It's a very difficult situation. We're super worried about people. We run 2 community centers here in the capital of Amman, and we're not able to have our centers open and haven't been for a number of months. So we've moved many of our programs online. And we really ramped up early on in the COVID crisis our rapid response. From April to September, we were able to serve an average of 856 families by giving them cash assistance or credit at grocery stores to get the food they need. But it's been very difficult for us to keep up that level of funding like many other INGOs here. And we've been decreasing that since September and are going down to only 165 families that we're able to help beginning in January. we really have increased the amount of outreach, mainly by phone, that our staff and refugee volunteers do to our whole community, to check in on people, see how they're doing, let them know that, you know, we care about them, we're concerned, see how they're doing. Also to, you know, really think about protection, see, you know, are they feeling safe? How are things in their family? And a lot of our programming really focuses on protection. We work a lot. We have our online family violence awareness and prevention work that we do with men and boys. That has moved online. We run a lot of support groups, as well as particular support groups for parents who, like everywhere around the world, they're really struggling, but have a lot of programs to help people learn tools to be able to take care of themselves and deal with their stress. Yeah, it's very difficult times. We see that people are struggling, and you know, our volunteers, staff, and all of us are doing what we can. I think I'll stop there, and I'm looking forward to taking part in the Q&A. Thanks very much.
Thank you very much, Amanda, for such an excellent presentation. We'll move on to our second panelist, who is Dr. Rizkallah, Dr. Naveen Rizkallah, who recently researched the needs and challenges of Syrian refugees in Lebanon. She also researched the challenges of aid workers providing services to refugees and local populations during the COVID-19 pandemic. Dr. Rizkallah is a Palestinian scholar. She holds a BA in psychology and English literature from Ben Gurion University. She has a PhD in social work from Tel Aviv University, and she is also a specialist in couple and family therapy and group facilitation. She served as the volunteer coordinator at the Haifa Rape Crisis Center and the director of the Haifa Ministry of Health's mobile clinic, where she treated women, men, and LGBTQ individuals involved in prostitution. She also trained professionals and volunteers on dealing with sexual violence. She was a postdoctoral researcher at the Max Center on Mental Health and Social Conflict at the School of Social Welfare at the University of California in Berkeley. Her research interests are fascinating. I could go on for ages, but they are at the interface of trauma and its impact on physical and mental health. She had authored papers, peer-reviewed papers, and book chapters on many social issues, including prostitution, pornography, and trafficking of women, marital adjustments amongst Palestinian and Jewish married couples in Israel. These are just to name a few. In the past 10 years, she has also researched and conducted field work with Syrian refugees, Palestinians, torture survivors, and other vulnerable populations in the Middle East region. Her most recent project is entitled Challenges of Aid Workers Serving Refugees in Lebanon Before and During COVID-19, which is extremely relevant to today's panel discussion. Welcome, Dr. Naveen Rizkallah, and good morning to you. The platform is yours.
Thank you, Maher. Thank you for this introduction. I would like to talk to you about the research me and my students have conducted during March and April 2020 in Lebanon. The research is called The Challenge of Syrian Refugees and Aid Workers in Lebanon. And its perspective is we compare between the situation of both refugees and aid workers before COVID-19 and during COVID-19. The Syrian conflict has taken a brutal toll on the Syrian people, and more than 6 million Syrians fled to neighboring countries, including Lebanon, which hosts the second largest Syrian refugee population. The refugee influx has overburdened the already overstretched infrastructures in Lebanon. Organizations working and providing services to Syrians struggle in maneuvering the programs and resources offered to refugees. as well as finding funding for their services. So my students and I, we wanted to study and examine the challenges of Syrian refugees and aid workers who assist them, and to see if there was any difference between the situation before COVID-19 and during COVID-19. I would also want to offer a perspective on what also happens to researchers who conduct studies in these situations. It's not only COVID-19 has affected everyone, not only refugees and aid workers, but also us, the researchers. So I want to also include that in my conversation with you today. In our initial phase of the study, the research team approached contact in the Middle East and established connection with on-the-ground non-governmental organizations, which work with Syrian refugees. My two students, Janelle Mubaraka and Liane El-Kazaz, they were set to travel to Lebanon. They got funding to travel, and they wanted to see refugees and gather survey data from them. And they also wanted to conduct semi-structured interviews with staff working at NGOs that provided aid and services to Syrian refugees and to the local Lebanese communities in need. However, as a result of COVID-19, travel-related restrictions were put into effect, which prevented the implementation of the initial study design. So we needed to change the whole study design to adjust to the new circumstances. Therefore, we switched and immediately shifted to be completely remote and focus entirely on the semi-structured interviews with the staff of NGOs. The data collection took place between March and April 2020. Remote semi-structured interviews were conducted with Skype, around 37%, with Zoom, around 36%, and WhatsApp, around 26%. And we conducted these interviews with 19 aid workers who worked in 6 organizations and provided services to Syrian refugees in Lebanon. These organizations were Women Now for Development, Basma and Zaytuna, Relief and Development, World Vision Lebanon, Akuruna, Shield Lebanon, and Serapta. The audio recorded interviews were both in English and in Arabic. 52% were in English, and 37% were in Arabic, and 10% were mixed between Arabic and English. Of course, participation was voluntary, and only oral consent was required from participants, and we didn't provide any incentives to the aid workers who participated. The interviews were then transcribed, translated, and analyzed by the team of the researchers, and we used thematic approach of analysis within the qualitative methodology approaches. The two students were both undergraduate students at UC Berkeley who did not have any previous experience with conducting such a study. So also the amount of stress in switching the study design and interviewing people remotely, also facing themselves with COVID-19 and the new restrictions and being quarantined during the study have also added some challenges to the study. Results. I would love to share some of the demographics of the participants. So the participants were aid workers. 58% were women, 42% men, 52.6% were Lebanese, and 42% were Syrians. They work between 30 to 70 hours per week, on average 42.9 hours per week, and their age ranged from 24 to 60, on average 33.6 years old. And the majority were married, around 47%. And the analysis have showed that there were two distinct chronological periods that the aid workers identified. One period is related to the challenges before COVID-19. And when aid workers talked about that, they mainly focused on the challenges that refugees faced. When we talk about during COVID-19, okay, thank you. If I'm too, okay, thank you. So the two chronological periods were identified, challenges before COVID-19, and they mainly focused on refugees. Whereas during COVID-19, the challenges that aid workers articulated were related to both refugees and the aid workers themselves. Suddenly, they started talking also about themselves. It wasn't only about the refugees who faced challenges, which shows how human we are, because everyone, us, also the researchers, we were also facing similar challenges. So before COVID-19, the main issues that aid workers mentioned about refugees challenges were that Syrian refugees' legal status in Lebanon was identified as a primary challenge to their living conditions. The difficulty in obtaining residency paperwork limits their ability to secure housing, employment, and education. According to all participants, Lebanese hostility towards Syrian refugees is more prominent in urban areas in comparison to rural areas and has escalated even after the October 2019 uprising. The aid workers were very concerned with the worsening economic situation, particularly after the protest, as increasing prices and the inflation of the Lebanese lira pose challenges to their ability to provide services. Now, you need to understand that during these interviews, because we were in March, April 2020, it was during the eruption of COVID-19, then the interviews, if you read the sequence of the interviews, you would be very confused because aid workers kept comparing between the situation before COVID-19 and during COVID-19. And at times, the students, both Jen and Eliane, they were like asking, are you referring to before COVID-19? Are you referring to the current situation? So the periods have been confused between the challenges before and after. So everything was a big mix. So during COVID-19, the primary concern was that while Lebanese government orders have been put in place to limit the spread of the virus, too many people, especially Syrian refugees, work daily jobs. They needed to work every day, which prevented them from practicing social distancing. And the ones who could not continue their jobs, they were sitting at home unemployed, which have also increased during COVID-19. So taking all of these compounded with the economic decline, refugee conditions have deteriorated, and many are in dire need for food, masks, hygiene kits, and other protective measures. Aid workers also articulated that they have seen negative coping mechanisms increasing, such as aggression and depression, and they were especially concerned about domestic violence that has increased during COVID-19, or if did not increase, but it took a more aggressive form. And few of them mentioned a father throwing his daughter, an infant daughter, from the window. So these incidents were talked about during these interviews in a lot of amazement that this was unusual behavior. But they reflect the extreme difficult challenges that refugees are dealing with. Refugees' decreased living conditions have increased the fear of the Lebanese community. The Lebanese community thought that because refugees could not afford the hygiene kits or protect themselves and have protective measurements, maybe they will have more of the virus, even though that studies did not show a difference between the local and the refugee community. Still, the fear increased within the Lebanese community, and they wanted to be isolated from the refugee communities. Refugees who live in informal resettlement arrangements were not allowed to exit their resettlements, which is already highly populated. Only one member of the resettlement was allowed to exit in order to meet with a team leader of one of the organizations to receive food baskets, hygiene kits, and other necessities for the whole resettlement. So one person only went out, took what he needed for the whole community. Refugees who suffered and escaped the traumas of war faced another cycle of trauma during their displacement. So in regards to trauma, these refugees have escaped the war already and faced trauma already, but when they came to Lebanon, they faced another trauma and another shock of this unwelcoming hospitality. And unemployment and housing issues and malnutrition and so many facts together. And this was also experienced as traumatizing. However, with the eruption of COVID-19, these refugees suffer from a triple trauma due to the strict shelter-in-place restrictions, social distancing, isolation, Lebanese governmental hostility, and the local hostility. When when I asked about when the aid workers talked about their circumstances and not the refugees during COVID-19, they provided the following. Organizations shifted to remote programming and services. At the time of the interviews, all participants were working from home, and only a few were allowed to meet with beneficiaries from the local Lebanese communities and the Syrian refugee communities, especially healthcare providers like doctors, nurses, pharmacists, and team leaders responsible for the distribution of food items and hygiene kits. And at time, if it was available, the cash assistance. They would meet with refugees near the ATM in order to help them in actually getting access to their cash if they didn't know how to do that. NGOs faced tremendous difficulties in reaching out to refugees, and they used phone calls for their educational programs and to talk to beneficiaries and just to ask how they were and check on them in general. Many refugees, unfortunately, don't have internet connection or devices, computers or iPads for remote meetings. And many suffered from the electricity disconnectivity that is common in Lebanon. So even when they had computers or phones, it was commonly disconnected because of the electricity disruptions. Consequently, these aid workers said that the working hours have increased during COVID-19, even though they were at home, and many have used smoking as a negative coping mechanism. They admitted feeling stressed and finding difficulty in adjusting to social distancing. And these were articulated especially by the ones who have elderly parents who they could not visit, and the ones who had children who were at home. This unusual and complex situation placed refugees and aid workers in a position defined in the literature as a shared traumatic reality, in which both the refugees and aid workers lived and worked under the same traumatizing conditions of the COVID-19 circumstances, and they were under quarantine. This stressful context was at times traumatizing, and I call it a shared traumatic pandemic reality. This situation was also shared by the researchers who conducted the study. They were also interviewing participants during being quarantined. The conclusions and implementations that I would like to offer, is that this study offers an updated and holistic understanding of the challenges faced by both Syrian refugees and aid workers in Lebanon, as well as researchers who investigate COVID-19 consequences in conflict zones. The political and economic situations in Lebanon have imposed an unwelcoming hospitality towards refugees. Such circumstances have become even more complex under COVID-19. More than ever, the humanitarian sector needs funding to enable the support of the most vulnerable, both in the host communities and refugee populations. We also recommend that mentors and supervisors at academic institutions provide their students and staff with safe spaces to contain all the stressors conveyed during these unprecedented times, in order to enable productivity, growth, and empowerment, especially when conducting an international research during a certain traumatic pandemic reality. Thank you for listening.
Thank you very much, Dr. Iskalla, for this contribution. I'd like to remind our audiences that this is a Commonwealth Club virtual program with Dr. Naveen Riskalla and Amanda Lane. I'm Maher Kalaji, today's moderator. Now it's time for the question and answer period. We have a few questions, so let us begin with that. I would like to start with a question to Amanda, actually. Naveen has already touched on the hostility towards the Syrian refugees, in Lebanon. I know that in Jordan, you've had refugees initially from 48, 67, from the from Palestine, and then the Lebanese refugees, and then the Iraqi refugees, and the Syrian refugees, the Yemeni refugees, and I'm sure now there are other refugees who are arriving into the country. So it's been very welcoming as a place for them. But the devastating effect of particularly the second wave of COVID left some serious problems for the country in terms of the economic crisis. As you mentioned, there are day laborers there. So what I'm trying to lead to over here is, have you noticed any refugee welcome fatigue in terms of the people you've been working with in Jordan?
That's a good question. How to answer that? Well, it's a little difficult to answer it in many ways because we've all been kind of working from home, and our centers are closed and people are trying to stay at home. What I can talk about briefly is, that Jordan has a very real history of being welcoming to refugees, as you've mentioned. I think, they're in a number of cases, I think as numbers kind of get bigger, particularly with the Syrian refugee crisis, that we have so many Syrian refugees here. Looking at the economic situation, the high unemployment that we have among Jordanians to begin with, that, it's always been a bit of a dance. The government has been happy or let's say welcoming to host refugees, yet doesn't really, definitely needs help from international governments to be able to support them, as well as international NGOs like ours and local community-based organizations. Everybody's chipping in to do what they can. As for refugee fatigue, that's something that I think particularly I've witnessed in the 10 years that I've been back here in Jordan. It has been very interesting to me that, in the number of years that I lived here in the late 90s, early 2000s, that, Syria was, and I'm talking about Syrians in particular, that Syria was really, really seen as, this great civilization that I think Jordanians in many ways really looked up to and felt very happy, I think, early on to be hosting Syrians. As the economy, gets battered and continuously even more battered during COVID, that's something that has become difficult. Definitely refugee fatigue. I can't really speak to increased refugee fatigue due to COVID. I haven't heard much about that or read much about that, but I can say that, there's a lot of stress across the country. People are, not just refugees, but Jordanians are really struggling to make ends meet. If we look at kind of assessing vulnerability, refugees in general come out as being quite a bit more vulnerable than even vulnerable Jordanians, yet it's still difficult all around. So I'll stop there. I hope that was a decent, helpful enough answer.
It is. Thank you so much. The follow-up to that is clearly you have some interaction with the government over there, hopefully, and has there been any negative or positive response to your work over there in terms of, particularly during the COVID pandemic?
Absolutely. As I mentioned, the government struggles to be able to provide support for Jordanians who are in need. The economy has not been great, and it's difficult. When COVID first landed in Jordan, there was a very, very serious lockdown, to the extent that INGOs like Collateral Repair Project and others, the Oxfams, the CARES, the Mercy Corps, we couldn't drive. We weren't allowed to be in cars. We weren't allowed to leave the neighborhoods. It was really, really difficult for about 10 days early on. And this happened quite quickly. We knew of, we were terrified. We knew of so many families that we had no idea how they were going to eat because the banks were closed. We didn't know how to help them. We were very lucky in a way because we literally had staff walking to grocery stores when they opened in neighborhoods where people could walk to grocery stores and get the food they needed. And we were able to just say, hey guys, once the banks open, we're going to give you credit to pay for this list of families. And so families were able to walk to the grocery stores. And the Jordanian government began an effort to raise funds to help people in need. Thousands and thousands of Jordanian families as well needed help. So we worked very closely with the Ministry of Social Development, and, they expressed to us very early on, they recognized that we were able to move very quickly. And we're very, very grateful for the role that small organizations like us who are able to be really nimble, but also larger international NGOs that can kind of raise an appeal and get money to help refugees, because the Jordanian government certainly isn't unable to do it all alone, and is very, very grateful for all of that assistance that anyone is able to offer.
There's a follow-up question to you, Amanda, before I ask something to Naveen. There was a question online, which is they're asking you to expand a bit on the programs that the CRP offers. And is there a way, the question is there a way also for people who are online in the USA to get involved online? How can they, because they can't travel over there, how can they assist with the refugees?
Yeah.
I mean, I know you're working in Jordan there, but clearly Naveen also has expertise in Lebanon. How do you, is there a way they can assist you? Can you suggest methods, ways of doing that?
Sure, I can speak. We run lots and lots of programs. I would characterize the programs that we run as being ways they might be learning, a place to learn, activities to learn skills, such as English classes or computer classes. We have a lot of kind of learning and vocational training. We also have a lot of opportunities for people to kind of come together and build community. And then opportunities and courses and classes where people can heal from trauma. We do a lot of kind of alternative approaches to what we call community-based psychosocial support. We have a lot of yoga classes. We teach people how to do relaxation techniques and meditate. I've mentioned support groups. Probably the easiest low-level way that people can help and get involved in programming with us is so many people are stuck at home. They love learning English, and we have a lot of people who just are paired with somebody to give English conversation practice. It's often a little difficult with the difference in time, especially for folks in the San Francisco and West Coast area. But yeah, we do that a lot, and are very grateful for people who want to connect. And I will say that also is a piece of the work that we do. Our organization started in 2006 because, it's an American organization, and we're very, we felt that connecting with Iraqis at the time, who were the main refugee population in Jordan, was really important as a means of reconciliation. So that piece of getting people together and interacting is really important for us. Sorry, I hope I didn't talk too long.
Thank you. Naveen, can I ask you a question? If you know from your contacts in Lebanon, has the big explosion in Beirut, has it affected the Syrian refugees in any way, and the general reaction to the COVID pandemic in general?
The explosion, you said?
Yes, the big explosion at the port. Have you got contacts there who may have given you information on the ground about what's happened with the refugees there, or the reaction towards them? Because the hospitals are overwhelmed as well over there. So do you have any information about this? If you can give me a quick answer for that, please.
Yes. The study was conducted in March and April, but the explosion was afterwards. And of course, I contact the people who were interviewed, the leaders of organizations and CEOs, just to make sure if they're okay. And many of them were impacted by the explosion. Many of them were physically injured and rushed to the hospital, or lost a car which was exploded, and etc., etc. And they also explained that the mental health of people who experienced the shelling and bombing in Syria now are not only they have displacement challenges and the pandemic to deal with, they have also experienced the bombing. That was a very, very bad recollection of the war bombings in their past. So this event was very, very traumatizing for the refugee population in Lebanon. And of course, anxiety and depression increased during that. And also the dire economic need that people just lost again their possessions and their the other things that they owned, a few mattresses, a few clothes that they could put their hands on. I hope
Thank
this
you.
is
Thank you. I mean,
quick enough.
thank you for a very, very good answer there. I mean, I know we have focused on your work with the refugees in Syria and, sorry, in Lebanon and in Jordan. But, let us not forget that, there are refugees who are in displacement camps in their own countries. And I was reading a report by the Norwegian Refugee Council about nearly 100,000 people without shelter in Iraq. They've been asked to close these displacement camps. And winter is harsh over there. So we have these people who are displaced in their own countries, and they are suffering as much as everybody else. We have not mentioned refugees in other countries. We have the war in Ethiopia now. We have the refugees in South Africa, the Rohingya in Bangladesh. So there are so many of these which are really impacted by COVID and the economic impacts of COVID. One thing which I want to touch on before we come towards the end, which is, that this pandemic has been devastating. We have up to today, 68.4 million people who have been infected, 1.56 million deaths. The light at the end of the tunnel, and every country is trying to get there, is the vaccination and medication. But at the moment, we're all rushing towards the vaccination. And I don't know if you're aware of this organization called COVAX, which is formed by the World Health Organization, the European Union, etc., and so many countries to ensure equitable distribution of vaccines. What worried me mostly in all of this is that there's something called vaccine nationalism. All the countries in the world have joined COVAX, except Russia and the United States of America, plus Kazakhstan, Belarus, and some of the small islands in the Pacific. I mean, that is really worrying, because the aim of COVAX is to ensure that even the refugees get the treatment like everybody else gets that. Fortunately, I think you're in countries where that will happen, but whether the goodwill extends from the major powers, that we're not sure about that yet. So that's just the point I wanted to raise at the end, because I think it's very important that we are aware of these issues that are facing the refugees throughout the world here.
Maher, I'd like to just say one thing, and I think that. Yeah, I think that, when I remember when before I moved back to Jordan, I remember, we talk a lot about refugees. We talk about these big numbers of people who are struggling. We know that around the world, so many people are struggling, in the United States and, wherever we are, there are people who are struggling. But I think it's, really important, what I've learned living here in Jordan and working closely with refugees is that, there are huge numbers of people, but they're just like you and me. I mean, we all have we all care about our families. We all want to be able to take care of our children. Like you said, some of them, literally don't even have a roof over their head or a true place to really live. And I think that, it's always important for us to put ourselves, think that, these are people, honestly, who are just like you and me. They're terrified of their family getting COVID and not being able to help them or save them or things like that. So I don't know. I just think that that's so important for us to really understand that, they're mothers and fathers and people who just want to take care of their families.
Thank you both so much for raising awareness on some really gut-wrenching issues, I should say. They really are. I wanted to talk to you about trauma, but I don't think we have time for that. So I'd like to thank our distinguished panelists.
I want to say a sentence, Maher, just before we end. In such inhuman circumstances, to combat trauma, the best is to act in a human manner and to contribute as humans, and to even if you can't hug the other person, send them a gift for the holidays. Send a contribution to any organization you like. I'm very objective about that. I don't care which organization, but if you want to do something, contribute, give, send something, say a good word, advocate in your position, whatever you can do to promote humanity in such inhuman circumstances.
Thank you so much for the very long sentence. So thanks to our distinguished panelists, Dr. Naveen Rizkallah, Research Associate at the Center for Middle East Studies at UC Berkeley, and Amanda Lane, Executive Director of the Collateral Repair Project, for their contribution to today's program, The Impact of COVID-19 on Refugees. And I would like to thank the technical staff at the Commonwealth Club for a fantastic program, the way they've steered it and guided us. You've done an excellent job. Thank you so much. And now the meeting of the Commonwealth Club of California, celebrating over 117 years of enlightened discussion, is adjourned. Thank you.
Thank you.